Hi, my name is John Consalvi, and I'm the CEO of LinguaHealth. I'm here today with Dr. Kathy Kronert from the University of Minnesota. She's a professor emeritus, and she's taking her time to chat with us a little bit about bilingualism and speech-language pathology. Dr. Kronert, thanks for coming.
Thanks for having me, John.
So, Dr. Kronert, what would you recommend to a graduate student that's bilingual, that wants to work with the bilingual population? What are some things they can do to prepare themselves to do quality work and to become competent with working with this population?
First of all, that bilingualism is so important. So understanding not only cross-linguistics, so one language versus one language, but how those two languages interact. So the best thing I think that a bilingual individual who is going to be a speech-language pathologist can do is to become just a superbly trained speech-language pathologist, to be knowledgeable about typical development, monolingual and bilingual, how they interact, so really be grounded in typical development. Then also be very knowledgeable about disorders in general. And then bilingualism. Bilingualism is really the icing on the cake. And so then understanding, if you have these distinct pieces of knowledge, then understanding how they interact is really critical. And I think for bilingual speech-language pathologists, because we talked about they're increasing in numbers, but I think they should also be advocates. All speech-language pathologists need to be advocates, but I think bilingual speech-language pathologists have this additional role to be advocates for administration to overcome this opposition to supporting two languages in children with language disorders, to be mentors to colleagues. And also they have an additional role, I think, to be able to consult. So broadening their role to be consultants for their monolingual colleagues who work with bilingual children. And then another skill is to engage in telepractice and to become skilled in that and communicating with colleagues versus various social media tools and with other types of devices, because they really have this, it's kind of incumbent on them that they take leadership in not individually working with all bilingual children, but in advancing the profession in its work with bilingual children. So becoming skilled in all sorts of areas.
Since there are some languages that are not spoken in certain regions or parts of the country, you feel that telepractice can answer some of those issues?
I do think so, because there are cases, for example, where Vietnamese English speaking speech-language pathologists can provide support for a parent who speaks Vietnamese with her 2-year-old child who is in another state, or with a bilingual clinician who speaks maybe Hebrew and English and is in New Jersey and is providing services, more direct services, to an adult with aphasia who speaks Hebrew and English in California, to really maximize their effectiveness. I do think it can help bridge some of those, some of the disparities. It's not a tool. It doesn't work for everything, but I think it can help.
I like your statement about advocacy. One usually doesn't think that advocacy is part of graduate school training. Mm-hmm. So how does a graduate student start thinking about advocating for a caseload that they may never have, or they're theoretically preparing themselves for? I
think in the clinical practicum, it's a natural transition with that. I think ASHA does a fair amount with its leadership positions, and it has a minority leadership program at the annual ASHA conference that I've heard from former students of mine who went, that it was life-changing, which is quite a statement, so life-changing. I think it also has to be included in coursework and as really very specifically addressed. So like a lot of things we do with bilingual kids, if we just say, oh yeah, I support two languages, but it's not explicit, it doesn't happen. So with advocacy, I do think that it has to be included in coursework, and I'm not sure. I think that's every institution how they approach it, but either within bilingual courses or within counseling and professional issues courses, because I do think it's a professional issue.
Well, it's true. If you don't have the content like you mentioned on a prior discussion, if you don't really know the information, it's hard to advocate.
Yeah, no, we don't. So, we don't want those ambitious people who don't know anything. That's really frightening.
Right.
But yeah.
So it's true. I mean, getting back to the, be a great clinician, learn language, learn, your coursework at a high level, master that, and this will allow you to do a lot of other things. But if you don't have that basis, then it's harder to do
It is.
advocacy, definitely.
It is, and you don't have the confidence or the clarity in communication either to do it. So yeah, the knowledge and skills first, and then advocacy.
It's, when you're advocating, you're always challenged. So
Yeah.
if you don't back that up, then it's a problem.
Yeah, yeah.
Well, Dr. Konert, I really have enjoyed our time today, and I'm really happy that you shared your expertise with everybody that's going to watch this video on YouTube.
My pleasure, John.